Trailblazing community effort. 6 months ago, it's been 6 months since the Norton West Louisville Hospital opened its doors to patients. We've been following it closely after the first month and now this major milestone. Since then, the hospital has been getting a lot of national attention. So we asked Norton CEO Russ Cox, who got it built, to join us once again for a progress report.
And thanks for being here, Russ. We really appreciate it. So I want to ask you just right off the top, what's been the biggest challenge in the last 6 months since you've opened your doors?
You know, I don't know that it's a challenge.
Okay.
I think that what has been eye-opening to us, if I could go there, is that if you actually go into a community, ask questions, listen, and then incorporate them into the design, it's accepted and people want to use the facility and feel as though it's their own. So the challenge really has been for us is what's next? How do we continue this momentum? How do we continue to do the things that we said we were going to do that the community told us that they wanted us to do? If you look at 10,000 people have been through the emergency department at Norton West Louisville Hospital in 6 months. Double that, 20,000 in the first year of operation is just incredible and really says something. But perhaps more importantly there, 1,300 people have been in for primary care visits. We heard so much about the need for primary care in West Louisville. And what I love is we heard so much about don't just focus on healthcare, focus on the whole person and those barriers that exist and how you can help. And just our food pantry alone, we've served over 4,000 families in 6 months. So everything we wanted it to be.
And that's free food people can
get.
It is. For donor care.
That is exactly right.
You built Norton West Louisville Hospital to really be a preventative type of hospital. One-stop shopping, doctor's appointments there, all kinds of different fields represented there. So let's talk about the preventative care. How many patients have you all been hearing about who are seeing doctors really for the first time?
So many. And what we've learned there is being permanent in the community and being accessible within walking distance is really added to that. Now, amazing to me too, as well, is we're getting patients from East Louisville, we're getting patients from South Louisville, we're getting patients from Bullitt County. This has become a community hospital in so many ways, not just a West Louisville hospital. And that makes us feel very good that we're having people who recognize that great care is delivered west of 9th Street, which we were the first hospital to be built there in over 150 years.
So do you think some of that is people just wanting to come and check out the new hospital, or they want to use the new facilities, or a little bit of both, or what do you think that's
I think it's many things, Connie. I think it's that, and we welcome that because we want to show people that West Louisville is a wonderful place. I think some of it, too, is about access. And that is being able to get in quickly for a procedure that you want to have done. I think some of it is just the transportation is easier off of I-64 and off of the Waterson. So there's a multitude of reasons, and probably the greatest of which is the culture that exists at Norton West Louisville Hospital. If you know Corinza Townsend a little bit, you know for a fact that she has assembled a work group that is second to none. And she does great things, and it's a very welcoming environment.
She was here supporting our flood fundraiser after thunder over Louisville. You said this at the beginning from day one, that this hospital does not need to be a moneymaker. You're the CEO. You're declaring it doesn't have to be a moneymaker. Is that still the case, and is that the way it's going to be, the way it's working out?
Yeah, CFOs everywhere pulling their hair out as you say that. You know, Doug, one of the things we looked at was, as a not-for-profit healthcare system, we have an incumbent responsibility to really look at what the needs of a community are. And what we saw was that life expectancy being so dramatically different from parts of our community to the other parts, many cases a 15-year difference. So I always said the ROI that we're looking for is shrinking that and also improving access in a place where people can get the services they need closer to home. So if it ends up making money, we'll reinvest it in the community. One of the things that I'm really proud of, too, is that we've expanded our financial assistance policy so that we've got by far the best, as I think, of financial assistance. A family of 4 making $130,000 a year or less can get their health care for free at any of our hospitals in the Louisville area. So we're all about getting people in a preventive sort of way. I personally hope we don't ever fill those 20 beds.
You're very open, and certainly you said you didn't mind talking about, you know, things like nursing shortages, and we've had some crimes against nurses, that kind of thing, at hospitals all over the city. Where are you all with staffing, and are there any concerns there?
Well, patient safety is always been a number one thing for us, but it also is employee and caregiver safety that we have to focus on. And we need to make certain that we're continuously looking at ways that we can improve that. Think about this. We have about 4 million patient encounters a year. And those are not always patients or families' best days. They're very high, very emotional days, very tense days for people. Sometimes they're seeing a loved one in the worst possible state that they can be in. So we automatically know that emotions run high. And we also know that that can manifest itself in some ways that we don't want. So our caregivers deserve to have the safest environment that we can possibly have. We've got to hold patients accountable for their behavior. We've got to hold ourselves accountable.
Have you all been beefing up security for them lately in the hospital?
You know, in the past 2 years, we've invested over $40 million in additional safety and security. And it's everything from infrastructure to increased security officers' presence to making certain that we have as many possible safeguards as we can for people on their way to work and on their way home. Because the experience that a caregiver has, and by the way, these are people who've dedicated their life to serving others who deserve safety more than they deserve safety. So from our perspective, we want to work together. If anybody's got ideas as to how we can do that, that's currently providing care for us, we want to partner there, and we want to make sure that we're doing everything to make them feel, because we know outcomes improve in a safe environment.
Right.
And we know that people want to come to work for a place that provides a safe environment. So it's got to be up here.
We want to thank you for that. And thank you for coming in. Amazing numbers you're bringing us about the hospital 6 months later.
Absolutely. We're thrilled, and we'll see you in a year.
Okay.
That's right.
You said it.
You've got a spot reserved right there.